And we don't even know how to thank them.
Yeah,
We've sent some of them Christmas cards
We did send them.
with a note of appreciation, but
Yeah.
it's so inadequate compared to what we owe them.
Yeah.
And the gratitude that we have for how good they were to us.
Yes.
They have defended our country in a way that no one ever thought would be possible. We've lost a lot of people in our community, and we continue to lose people in our community. I think healthcare workers and frontline workers have been an inspiration to people across our country and here in our community. They've seen it all. They've been through it all. They were with us. They held our hands. They were with our relatives and loved ones who passed away alone. They made sure that someone was there for them. And I think they are today's heroes. I think there are not only frontline workers, I see them as soldiers. I see them as troopers, like our military. They have defended our country in a way that no one ever thought would be possible. And for that, we owe them a huge debt of gratitude, and they've had our backs. And as a member of Congress, I will always have their back.
Healthcare workers mentality, you know that you're going to walk into a room and you're going to clean somebody's body parts because they've had their body movements. You're going to suction their airways. You're going to place them on life support systems. You're going to place them on mechanical intubation. You're going to start intravenous lines. You're going to bathe yourself with their body secretions, knowing well that not only you, but those people that live at home with you are being exposed directly to this disease that can kill you and kill your loved ones. And yet, nevertheless, a healthcare worker has put others' interests before their own, understanding the risk. There's one thing where you do something and you don't even know what the risks are involved. So out of a lack of knowledge or ignorance, you may do something that's very brave. It's a different thing when you know exactly what you're getting into and you're still willing to put your life and your loved one's life in harm's way. We have over 1,000 people in the United States that have paid the ultimate sacrifice. We have over 5 doctors in the Rio Grande Valley, over 20 nurses in the Rio Grande Valley, unknown number of paramedics and other healthcare professionals that have perished. And these people have given their ultimate sacrifice as a soldier would in war, as this is a war against the virus, in order to protect our community. So I absolutely have the highest respect, highest admiration for those people that are willing to put others' interests in front of their own, even if it includes potentially harming their families and succumbing themselves to death.
our country has been suffering through this pandemic for almost 9 months now. And what we have seen during every day throughout this pandemic is the men and women on the front lines in our healthcare industries risking their lives to save lots and lots of people. Without their efforts, without their sacrifice, one can only imagine how much worse the situation we are in, would be. We hear stories of healthcare workers, going home and sleeping in their garages so they can protect their loved ones. Quarantining in places other than their homes for weeks at a time. And then of course we have the devastating stories of those healthcare workers who have themselves either been infected and lost their lives. And so the healthcare industry has taken a huge toll in an effort to make sure that we are all healthy.
I might have been the first hospitalization in Cameron County with COVID, because I went in on March 28. And I had already been with fever, been to see the doctor, and thought I was going to get over it. And instead, I got worse. So on the 28th?
The 28th,
I actually went by ambulance to the hospital.
Yes.
Went immediately on the ventilator for 16 days. And actually, I don't remember my time there very much. There's very little that I remember, but what I remember was how much work it was for the doctors and the nurses. Every time they came in the room, they had to put all the protective gear on, gloves, head protection, a mask, and gosh, I didn't want to call them for anything, because it was really a job. They stuck with us, and I think there are several things that's notable. One, they took care of me. But two, Ruth Ann not being able to see me was really at a disadvantage and felt pretty much left out. Except the doctors called every day, and she has a lot to say on that.
I have a lot to say, because if it weren't for the Valley Baptist and the wonderful doctors and nurses, and I know some names here that I'd like to put out, but Dr. Reyes, Dr. Suarez, especially Dr. Castillo, who was untiring in contacting me every day about him. The nurses would help me with FaceTime, and they, even though it was difficult for them to do that, they did it. And I can't begin. He would not be here if it weren't for them. He would not be living right now. I know that for a fact. And we're so grateful. I'm so grateful to them.
Personally, I got sick also, and I was hospitalized. And I saw it with my eyes, the heroic work of our staff at DHR. I'm talking about from the people who are the janitors, the people who are the nurses' aides, the nurses, the whole staff. To me, all of them are heroes, because I saw that and even in the room that I was sharing with somebody else. Unfortunately, that person died even beside me, was very sick, and other people dying because of the COVID. The whole medical staff, and they were there, present there, taking care of us. And the nurses, heroic. The work that they are doing is heroic. Some doctors that are there, the infectious disease doctors, the critical care doctors, the hospitalists, they were there with us, taking care of us, examining us. To me, all of them are heroes, in this pandemic, knowing that they can get the infection, knowing that they can get sick, or even knowing that it could be that the small percentage of the people that died due to the disease, but they were there taking care of the ill people. And also as a physician, I've been doing this also in my primary care clinic. we're taking care of our patients. My staff, even I consider them heroes. Almost everybody got sick, but thanks God they did very well. And still we're working and seeing patients.
I'm 82, and I have a whole new appreciation for the doctors in the medical field because I've never had anything like this before, and I'm just shocked that they can be so compassionate and so caring and so persistent to get me through it.